Hello everyone, welcome back to my channel. Ginger is an ancient spice and herbal remedy originating in Asia. It has been used in traditional medicine systems for various health applications for thousands of years. The root, or rhizome, is the most commonly used part for medicinal and culinary purposes. Modern research has confirmed many of ginger's traditional uses. Studies show ginger can help reduce nausea, relieve pain, lower blood sugar and cholesterol levels, and decrease inflammation. It contains compounds like gingerol, shogols, and zingerone, giving it potent effects. Some proven benefits of ginger include alleviating nausea from motion sickness, pregnancy, or chemotherapy. It may also improve symptoms of osteoarthritis, menstrual cramps, and post-exercise muscle pain when taken regularly. Ginger is a tasty culinary ingredient that adds flavor and zing to dishes. However, while ginger is generally recognized as safe, there are some precautions to be aware of. In certain populations, ginger can cause adverse effects or interactions. In today's video, we will review specific health conditions where medical experts recommend avoiding ginger or using it cautiously. I'll overview the concerns while also providing tips for safer ginger consumption. As with any supplement, it's wise to discuss ginger with your doctor to see if it is appropriate for your health history and any medications you may be taking. Ginger can be a beneficial herbal remedy when used responsibly and under medical guidance. Now, let's get into an evidence-based look at who should limit or avoid supplemental ginger intake. 1. Bleeding disorders. Ginger contains compounds that can thin the blood and inhibit clotting. For those with bleeding disorders like hemophilia or von Willebrand disease, ginger supplements are not recommended. Von Willebrand disease is an inherited bleeding disorder that causes extended bleeding after injuries or procedures. The anti-clotting action of ginger could worsen bleeding and bruising in those already prone to these issues. Even culinary amounts of ginger may prolong bleeding time in these populations. The effects of ginger are particularly concerning should an acute bleeding episode occur, as it may inhibit the body's natural clotting process. Those on blood-thinning medication like warfarin should consult their physician before taking supplemental ginger. The combined effects could lead to a higher risk of uncontrolled bleeding. So, it is best for those with known clotting disorders or who take blood thinners to avoid concentrated ginger supplements and limit ingestion of culinary ginger. 2. Diabetes. Ginger has been shown to lower blood sugar levels, which could potentially be useful for diabetes management. However, this effect also comes with precautions. Consuming ginger along with anti-diabetic medication could lead to additive effects and increase the risk of blood sugar dipping too low, also known as hypoglycemia. Symptoms like shakiness, sweating, rapid heartbeat, confusion, and seizures can result. Those with diabetes should monitor blood glucose closely when taking ginger. You may need to adjust medications under the guidance of your physician to account for ginger's glucose-lowering action. Ginger capsules impact blood sugar more significantly compared to powdered ginger. It's ideal to consult your endocrinologist or diabetes educator before using ginger supplements regularly. 3. Heart conditions. Due to its effects on blood pressure, cholesterol, and blood thinning, ginger may interfere with some medications for heart disease. People taking nitrates, calcium channel blockers, beta blockers, and statins should exercise caution with ginger. Its ability to lower blood pressure may cause hypotension when combined with these medications. Those with existing hypertension also need to be mindful of ginger interactions. People with cardiac arrhythmias may also be sensitive to ginger's stimulatory effects on heart rate. Have an open discussion with your cardiologist about the safety of ginger, given your specific cardiac medications and overall heart health. Therapeutic doses may be fine under medical guidance, but avoid consuming excessive ginger. 4. Acid reflux. For those with gastroesophageal reflux disease and chronic heartburn, ginger may worsen symptoms. Ginger contains compounds that can cause relaxation of the lower esophageal sphincter. This allows acidic stomach contents to flow up into the esophagus, where they can cause damage and irritation. If you have mild reflux, occasional culinary ginger use should not pose much of an issue. However, concentrated supplements may provoke symptoms like burning chest pain and regurgitation. Those with reflux should limit ginger intake and stop using it if symptoms worsen. Try switching to other herbal teas and spices that are less irritating to the GI tract. 5. Gallstones. Ginger has been scientifically proven to enhance the production of bile, which in turn helps in the digestion of dietary fats. However, this effect may be problematic for people prone to gallstones. Excess bile can concentrate in the gallbladder and contribute to stone development. For those who already have gallstones, ginger's stimulation of bile flow could trigger colicky pain and gallbladder attacks. If you have a history of gallstones, avoiding large or concentrated doses of ginger is advisable. Mild ginger usage through tea or cooking is less likely to cause issues, but pay attention to your body's response and discontinue use if any gallbladder-type pain arises. 6. Kidney disease. Due to its diuretic properties, ginger may affect kidney function, particularly in individuals with compromised kidney health. Ginger can increase urine output, which may lead to changes in electrolyte levels and worsen dehydration. If you have been diagnosed with impaired kidney function, use caution when consuming therapeutic doses of ginger. Be sure to stay well hydrated to avoid complications. Start conservatively with low amounts of ginger and monitor your body's response. If you are on diuretic medications, discuss ginger use with your nephrologist, as a combined diuretic effect may develop. Culinary use of ginger should not pose any issues for most people with healthy kidneys. 7. Surgery. Ginger's antiplatelet properties also come into play for those undergoing surgery. When taken during surgery, ginger may inhibit normal blood clotting and increase the risk of bleeding and bruising. If you have a scheduled surgery coming up, it is recommended to stop taking ginger capsules or tablets at least 1 to 2 weeks prior. This allows ginger's anticoagulant effects to wear off and minimizes surgical complications. Under your physician's guidance, you can resume ginger supplements after post-op recovery. Be sure to disclose any herbal supplement use to your surgical team. 8. Pregnancy. Concerns exist about the safety of consuming high doses of ginger during pregnancy. Ginger might increase the risk of miscarriage by stimulating uterine contractions and menses. While some studies have found ginger helpful for nausea and pregnancy, experts encourage conservative dosing. Pregnant women should minimize intake of ginger supplements and concentrated forms like extracts. Include ginger only occasionally as a spice in food instead. Discuss ginger use with your OB/GYN to determine what is suitable given your pregnancy factors. They can monitor you for any red flags if you decide to use ginger. 9. Ulcers. People with ulcers in the stomach, duodenum, or intestines should avoid therapeutic doses of ginger, as it may irritate the GI lining. Due to its spicy and energetic properties, ginger can be particularly aggravating for existing ulcers. Concentrated supplements may cause a burning sensation and worsen ulcer pain. If you decide to use ginger, start with very small amounts to see how your body responds. Discontinue use if any discomfort arises. Restrict ginger mainly to minimal culinary usage until your ulcers have fully healed. Then, you can discuss reintroducing ginger supplements with your gastroenterologist if desired. 10. Endometriosis. Ginger possesses compounds that may stimulate menstrual flow. For women with endometriosis, this is something to consider before ginger use. The stimulation of menses may worsen cramping and pelvic pain related to endometriosis. Ginger's effects on estrogen levels may also worsen symptoms. Those with endometriosis should consult their gynecologist before taking ginger supplements or ingesting large doses. You may be advised to limit your consumption during your periods when symptoms are more active. As with any supplement, start conservatively and stop using ginger if discomfort increases. In summary, ginger is a super spice that can have therapeutic effects, but it has some potential side effects and interactions you need to be mindful of. Talk with your healthcare provider to see if ginger supplementation and your health status suit you. For most people without underlying conditions, enjoying ginger culinary dishes or tea should not be an issue. Just don't overdo it. I hope you found this information helpful. Let me know if you have any other questions in the comments below. And if you're new here, be sure to hit that subscribe button and turn on notifications so you don't miss any of my upcoming natural health videos. Thanks so much for watching, and I'll see you in the next one.